Imagine going to the hospital for the birth of your child. The doctor tells you the baby is healthy, 10 fingers and 10 toes. You go home the proud parent of a little bundle of joy. Not long after leaving the hospital, you realize that your child does not respond to loud noises or turn towards you when speaking to him or her. After going to the doctor for a checkup and discussing your concerns, you find out that your child is deaf. Are you still the proud parent of the little bundle of joy you brought home from the hospital a few months earlier, or is your perception now changed? The child has not changed. They are still the same as they were when you brought them home from the hospital, and they are still your child, so of course you still love them. Now, being the parent of a deaf child, you are faced lots of decisions about their health care. Will you make the right ones? Today, I would like to discuss the issue of performing cochlear implants on young deaf children and hopefully persuade you to understand why waiting until the child is old enough to decide for themselves is the best option overall. Deaf individuals should be given the opportunity to choose whether cochlear implants are right for them or not, but only when they are old enough to make that decision on their own. It is not the right choice for the parents of deaf children to make such an important life-altering choice for their children before they are old enough to have a say. Cochlear implants, like any surgery, has medical risks involved, and having the surgery puts the deaf child into limbo between the hearing world and the deaf world. Health risks are one reason that cochlear implants should not be performed on young deaf children. Dr. Hartley Bessler, a family physician, stated in the article, "Cochlear Implants, I understand that most parents want what is best for their deaf child, but good intentions do not guarantee success." He goes on to explain how cochlear implants are still relatively new, and there are still a lot of unknowns about the implants. According to the USDA, there are a number of medical risks from the surgical implant, such as injury to the facial nerve, meningitis, SCF leakage, infection, blood or fluid collection, attacks of dizziness and vertigo, taste disturbance, and numbness. Cochlear implants are a lifetime commitment which must be maintained and cared for. As stated in the article, Cochlear Implants, many deaf people believe that deafness is a culture and has its own language, traditions, values, schools, theaters, art, writings, and social and political structure. Janice Springford, a deaf individual since the age of 8, states, "Deafness is not bad, deafness is not wrong, deafness does not need to be fixed." She also states, "What is between the ears is a lot more important than what is between the ears is a lot more important than what goes in the ears." This is a common thought process between deaf individuals. They do not see themselves as different or needing to be fixed. Miss Springford was given the chance to get implants when she was an adolescent and declined. She has not regretted her decision one single day. She states, "Parents are often so concerned that their child is handicapped that they do not see all choices and possibilities open to them." The article, Cochlear Implants, states that parents who want to make an informed decision should examine all options open to their child, including deaf culture. It also states that deaf parents of deaf children and deaf adults who have been deaf since birth are unlikely to consider cochlear implants for their children or themselves. It is a shame that medical options are sometimes the only options explored, and that deaf culture options are not even if even explored, are not given the consideration that medical options are given. Deaf children who consider cochlear implants usually learn to speak orally and do not use sign language. As mentioned in the article, Deaf People Should Stay Deaf, Angelina Straley, a member of Alberta Association of the Deaf, states that deaf children may learn to speak, but speaking and communicating are different. Without their own language, deaf children cannot communicate as well, and they never fully adapt to the hearing world. A child is better off in the deaf community where he or she is free to express themselves. As stated in the article, Cochlear Implants in Children, it is widely recognized that auditory stimulation should be provided as soon as possible after hearing loss is identified and to best ensure that the child can maximize residual hearing and reach auditory language and learning potential. In the movie Sound and Fury, one of the doctors stated that cochlear implants should be performed, the younger the better, because young children are still learning language. The doctor went on to explain that learning to speak orally is a natural process and much easier for young deaf children to learn than older deaf individuals. The editor-in-chief in an ENT journal stated, There is in fact little reason to condemn anyone to be a prisoner of deafness. It is not only to the advantage of the child and his or her family to eliminate hearing loss, but also to society, which will see increased benefits from these productive individuals. With these simple and one-dimensional options of why young deaf children should get cochlear implants, it is reassuring to know that not all parents researching cochlear implants feel the same. Kristen Snowden, a Canadian cochlear implant patient, became deaf at the age of 5 and received her implant at the age of 15. She described her implant as not like hearing at all. It was like a vibrating in my skull and very annoying. Self-esteem of a young deaf child should also be considered as well with cochlear implants. Deafness is not something that should make them feel handicapped, defective, or in need of being fixed. Snowden had her implant removed when she was 19, only 4 years after having it implanted. She stated after meeting other deaf people and discovering deaf cultures, she now accepts her differences and her self-esteem has really increased. Today we learned about why cochlear implant surgery should be the choice of the deaf individual. There are many medical, social, and mental aspects to analyze before a lifelong commitment should be made to have a cochlear implant surgery. With this surgery being more of a luxury for the parents instead of being for the young deaf child, the choice should be left up to the deaf individual. Taking into consideration both medical and deaf culture options is very critical to the decision-making process. The majority of cochlear implants are performed on deaf children of hearing parents, and unfortunately, all the options are not weighed equally. If I was blind and my husband were blind, we would not remove our child's eyes so they would be blind like us. That would be absurd. So my question is, why do hearing parents feel that they have to have cochlear implants for their deaf children? Even if their child does get the implant, they will still be deaf, and that is something they can never change. The parents of deaf children should love them for who they are and learn how to adapt their family and world so that everyone feels equal and accepted.